So if Tokyo says it's fine, so it must be fine. A very good evening, all of you. So today's live session will have textbook discussion. Okay. So I'll be covering a very small topic, but for which we'll use a textbook as a reference. We'll review the literature and try answering all the questions which are posted in the thumbnail, as you can see. So we have several questions in the form of thumbnail, right? So toxicity or biocompatibility of silver amalgam. So when we discuss biocompatibility, we deal with its toxic potential, local as well as systemic toxic potential, mutagenic potential, carcinogenic potential. So along with which we have the following questions, as you can see: safe level of mercury exposure in dental office, permissible mercury levels in urine, urinary mercury concentrations and their corresponding clinical effects, amalgam tattoos versus amalgam blues, what's the difference and when do you see them, and type 4 hypersensitivity reactions with silver amalgam, and few miscellaneous topics pertaining to the same. So I hope you guys are ready. So I've posted the relevant material in our updates group. You can simultaneously go through the same as I'll be going through this particular literature. So the reference is Materials Used in Dentistry by S. Mahalakshmi. We have used this book for extensive reference purposes, especially during post-graduation, along with Phillips and Craig. And this is personally my favorite book because you'll get plenty of information and it's all represented very well. So let's start right away. So I hope you guys are ready. Silver amalgam. So how biocompatible is it? So systemic toxicity. So there can be systemic toxicity. So let's see what systemic toxicity is all about pertaining to silver amalgam. Along with that, local toxicity, hypersensitivity reactions, etc. So you might have heard of Minamata disease. Minamata disease, which we discussed even previously, and also in e-classes, if you remember. So consider that as your homework. Find out what Minamata disease is. But before that, elemental mercury can lead to systemic toxicity. So you should understand the very fact that elemental mercury as such is very much toxic. It has systemic toxic potential. It can enter into human body through skin, that is through touch, or ingestion, inhalation of mercury vapors, and of all of these, touch, inhalation, or inhalation is the most common route of entry among patients, and dental personnel do underline this point, right? This is very, very important. Inhalation, okay? Now, moving on to the next point, the following are sources of mercury exposure in dental office, as you can see: improper storage of mercury, exposure during trituration or mixing, insertion and setting of amalgam, scrap or excess waste amalgam, exposure during finishing and polishing, and removal of old amalgam restorations. So you can have a question in this format like all of the following are sources of mercury exposure in dental office except. So you must be able to answer, right? I'm sure you're all familiar with them, and I'm sure you might have come across the same during your routine day-to-day clinical practice or even during your undergraduation. Now, safe level of mercury exposure in dental office is 50 micrograms of mercury per cubic meter of air per day. Just memorize these values. We already discussed them in our classes, so this is a repetition. Do memorize all these values or make a note of them. Okay. So safe level of mercury exposure is 50 micrograms of mercury per cubic meter of air per day. And transplacental transfer of mercury can occur with deposition of mercury in fetal organs. So it crosses placenta. And this can lead to mental defects or even behavioral problems. The permissible average mercury level in urine is 6.1 micrograms per liter. Do underline this point and consider this very, very important. Permissible level of mercury in urine. And the following health effects are noted as the mercury level in urine increases. If mercury level in urine is increasing, it corresponds to the fact that its level in body is also rising accordingly. That's the reason why you're seeing increase in levels of mercury even in urine, right? So urinary mercury concentration in micrograms per liter in one column, and also you can see the clinical effects on the other column. So 4 to 25, the range is between 4 to 25, no known health effects. 25 to 100, decreased response on tests of nerve conduction, brainwave activity, and verbal skills. Do underline this and consider this very, very important. And 100 to 500, kidney dysfunction, renal dysfunction. So, irritability, depression, memory loss, minor tremors, and early signs of kidney dysfunction are seen with the range 100 to 500 micrograms per liter of urinary mercury concentration. 500 to 1000 leads to swollen gums, inflammation of kidneys, produced or pronounced tremors, and nervous disturbances. Right? So, various urinary mercury concentration levels and their corresponding clinical effects. Now, coming to local toxicity. So, what local toxicity can we expect? So, obviously, when you're placing silver amalgam in a cavity, you can expect local toxicity either in the tooth or in the surrounding soft tissue, isn't it? So, surrounding soft tissue in the form of amalgam tattoos or hypersensitivity reactions. In fact, I've seen and documented some of hypersensitivity reactions related to dental amalgam during my post graduation. I still have those pictures. If they're available, I'll definitely share them in RE classes. So, localized reactions or localized toxicity. So, a reduced number of odontoblasts, especially pertaining to pulp, reduced number of odontoblasts, dilated capillaries, and inflammatory cell reaction is seen in odontoblastic layer following direct condensation of amalgam in deep cavities. So we think there will be no effects, but there will be some local effects. And a mercury, silver, tin, zinc have been detected in dentinal tubules of deep cavities. That's the reason why in old amalgam restorations we often see discoloration. Even if the amalgam restoration is fractured or it is still intact, you can see the discoloration because of seeping of these ions into the tubules, and these are visible through your translucent enamel, isn't it? You might have seen certain cases, or for more clarity, I'll post the pictures as well, okay? But after this session. And so these are some of the pulpal reactions. And coming to soft tissue reactions or oral mucosal reactions, so occupational mercury exposure can lead to gingivitis, bleeding gums, bone loss around teeth, desquamation of buccal lingual mucosa, non-specific. Coming to amalgam tattoos, which can occur due to unintended spillage of amalgam in periapical region during root end filling procedures or in gingival sulcus, etc. So during unintended spillage of silver amalgam, there can be amalgam tattoos. Okay. And coming to allergic reaction, type 4 hypersensitivity reaction or delayed hypersensitivity reaction. So type 4 or delayed hypersensitivity reaction may be seen in oral mucosa in contact with restorations, especially the buccal mucosa, tongue, etc. They manifest as oral lichenoid reactions which resolve on removal of restorations. And finally, coming to mutagenic carcinogenic potential, there is no such effects proven till date. So no evidence of mutagenic or carcinogenic reactions with silver amalgam. Okay, so these are some of the key points which I wanted to highlight in this particular video. As I said, it's a very short video with some important numericals and some important things to consider. Right. So let's complete this. I have some homework questions for you. Do make a note and get back through mail if you're interested. So, first one, what is Minamata disease? So, the first point which we discussed during our textbook discussion process is elemental mercury has systemic toxicity. So, what is Minamata disease? And what is the difference between amalgam tattoo and amalgam blue? As in, amalgam tattoo is something which is seen because it's a consequence of unintended spillage. It can be considered as a local toxic effect because of unintended spillage of silver amalgam. But what is the difference between, or what differentiates this amalgam tattoo from amalgam blues? In fact, we discussed that. And finally, how do you best dispose scrap amalgam in your dental clinic or in your department or elsewhere whenever you're using it? How do you best dispense scrap amalgam? Right? So these are three questions which I have for you. Consider them as your homework, and you're most welcome to get back through mail 24/7. Right? So I hope it's clear, and I hope this session is informative. So do make a note of these important points, and you can get back through mail for further assistance. Okay. So wish you all the best. Love you all. I'll see you again tomorrow at 11 a.m. Indian Standard Time. Take care.